So I am a woman in long-term recovery. I've been in recovery for 37 years. And, when I first got into recovery, really what I wanted to do was give back. And so that was the driving force for me to get into this field.
Happy New Year, everyone. It's 2023, a moment to reflect and take some steps to realize your resolutions or to embrace recovery and healing. Here at Empathy Effect, the Fors Marsh Media podcast that explores the human side of government, we're going to spend some time today learning about how the Substance Abuse and Mental Health Administration, or SAMHSA, has some key people and resources to help people through recovery. I'm your host, Melissa Harris, and just now at the top of the show, you heard from Dona Dmitrovic, a senior advisor at the Office of Recovery at SAMHSA and long-term person in recovery. Recovery looks different from person to person. There are a lot of recovery resources and strategies, and there is a lot of research going into recovery, support, and the perception of people in recovery. At the federal level, SAMHSA is a trove of information, funding, and support for not only prevention and treatment, but recovery as well. In our conversation with Dona, we'll learn not only about the evolution of the recovery fields, but about Dona's own 37-year journey through recovery. We'll chat about how her experiences and on-the-ground work helping people with substance use and mental health really helped shape SAMHSA's support efforts. Dona, it's an absolute pleasure to have you on Empathy Effect. I'm really thrilled to have you here to talk about recovery today. So first of all, just how are you doing?
I'm doing great. Thank you, Melissa. Happy holidays to you.
Happy holidays to you too. So today we're going to get to learn a little bit about you and also a little bit about the Office of Recovery at SAMHSA. But first, I want to sort of pick your brain on your own background because you've been in this field for so many years. So why did you choose to work in the field of substance use and mental health, especially recovery?
Well, thanks, Melissa, for asking me that question. So I am a woman in long-term recovery. I've been in recovery for 37 years. And, when I first got into recovery, really what I wanted to do was give back. And so that was the driving force for me to get into this field. I worked in residential programs. I worked in outpatient programs. I worked in a program specifically for female offenders transitioning back into the community, largely a number of them with substance use disorders. And then I decided to go back to school after I was in recovery about 5 years to get my master's degree. And when I got out of school, I guess I assumed that I was going to be able to get a high-level, high-paying job at the time, to be honest. And that didn't work out quite as planned. However, I did work for an organization. It was the Epilepsy Foundation of Pennsylvania, Western Pennsylvania. And at that point, I learned a lot about advocacy and how powerful parents' voices were to advocate on behalf of their kids for, IEPs and other services within, school systems. And, at that time, I was kind of wondering why we didn't have that same mobilization on the side of substance use disorder. And I ran into a friend of mine, and they were starting a brand new organization in Pennsylvania that was one of the first SAMHSA-funded RCSP, which is the Recovery Services Support Program. That was back in 1998. And at that time, they were looking for an executive director. He asked me if I was interested, and I got involved in this work. And that's about the time that I really got involved in not only recovery advocacy work on behalf of people with substance use and mental health disorders, but also really started kind of at that time developing and working with organizations providing peer recovery support services.
Wow. I mean, from your own recovery through all of these different roles you've played, it sounds like you've been through a lot and seen a lot. So how have you seen the fields of recovery really change and evolve? You've done a lot of on the ground work. So are there any particular stories that have stuck out to you that really mark these different changes?
When I first got involved, most people that were interested in peer support services or recovery advocacy work were folks that were coming from the 12-step communities. So it was they were people that had a passion to really provide a face and a voice to people in recovery. And at that time, we used to talk a lot about, we would be in church basements, and that's pretty much the only place you would see us. Over the course of, these 20 plus years, there has been such a movement of people being more open and freer to talk about their experience, not only with substance use disorder, but their recovery experience. I think that family members play a huge part in that as well. When I was in an active addiction many years ago, my family, it was always about, you didn't talk about it, you hid that. Families were ashamed of what was happening within their own family unit. But today, families are speaking out. And, I think it's great. So I would say the most significant thing was the fact that, people have kind of come out of the closet and really talked about their own personal experience, which then makes awareness not only of the issue of substance use disorders and mental health issues, but also, the fact that recovery is possible and people do get better. I can remember I was sitting at a family gathering, and of course, by this time I was in recovery maybe 15, 20 years, and we had a huge extended family, and everyone was sitting at the table talking about somebody that we knew that was in the paper that had been arrested for something, and they were calling this person a dope fiend and a drug addict and all those derogatory terms that we hear. I was like, hold it a minute. You're talking about me, right? But it's like they really didn't think about that, because there have been so many years that have been passed since I had used and had the behaviors of an active user. I was cured in their eyes. And so, I think, just the education piece is really important to keep on talking about. I think the other thing that has become, of course, to the forefront is recovery support services and how important it is. It's not just treatment. It's not just intervention. It's not just, harm reduction, but also supporting people once they get on their recovery journey. And what does that mean? And I equate that a lot to SAMHSA's 4 dimensions of recovery: home, health, purpose, and community. Mm-hmm. Like, everyone wants that, right? And so It is a way, if we can reach those dimensions and help people achieve success in those areas, they have a much better chance of a lifetime of recovery, whatever that looks like for them.
Yeah, I definitely want to hit on those dimensions in a second, but I don't know if you mind talking about your own journey through recovery and now supporting people over the years, but how have your perspectives around recovery and how we could best support people, how have those perspectives changed?
Yeah.
I know you said family is really important, but have there been any new revelations that you've come across?
Yeah, when I got into recovery, my recovery started in a 12-step program, and that philosophy was always total abstinence. And, back in the mid 80s, it was kind of like hardcore. That's how I think of it. Like, you either do this or you die, right? And I will tell you, when I got into recovery, it was a result of some members of that group that came to me and talked to me about, the consequences I would pay if I continued to use. And so because of that, I did get into recovery and stayed in recovery since then. But one of the things that I did prior to getting into recovery in 1985 was I was in medication-assisted treatment. I was at a job and they knew I had a problem with drugs and they wanted to help me. And so they gave me a list of names that, these are the things you could do and then you won't lose your job. And so, of course, I opted for the methadone clinic because to me, it seemed like it was the easiest thing to do, but I will say it was not. But anyway, I stayed in that program for a couple months and ended up relapsing or having a reoccurrence. And that was that. But, as I got into this work, I remember sitting and speaking at a conference with a couple other folks in medication-assisted treatment. And I did run a program when buprenorphine was first approved for opioids. opioid withdrawal and opioid treatment, I started a program providing recovery support services in Pennsylvania. But I was part of this panel of other folks, and they talked about methadone, and there was a really well-known recovery advocate, and she supported patients on methadone. And I said during my talk that methadone didn't work for me.
Mm-hmm.
And afterwards, she taught me a very valuable lesson. She said to me, well, maybe it was just part of the stepping stone for you to get to the next step to get where you are today. Gave me a completely different perspective, because it was all along I was thinking of that as, it just didn't work. And but it was a point in my recovery process where I did have some clarity. So, even though I did use again, there was a point of time during that time when I was going to the clinic where I was substance free. But anyway, I would say for sure, as more medications become available, being more open to that as part of the recovery process, because, back in the day, we heard a lot about, people weren't in recovery if they were using medications. And again, another learning experience for me was when I started this buprenorphine program with a colleague, a friend of mine, and, looking at the difference that made in people's lives was just amazing. And the other piece was working with the medical community, and the fact that at that point, this was back in early 2000s, there was still not a lot of talk about recovery. And so being able to educate the medical professionals around, addiction and recovery, and to have them actually see patients and see them go through that transformation of coming in withdrawal, and 2-3 months later, getting back into, their life, that was pretty rewarding. And I think with the advent of the medications, I think that has really helped the medical community become more aware of behavioral health issues. I will say that the fact that people are mobilizing all across the country, and it's not just people in addiction recovery, but it's family members, it's harm reduction. So, and I'm sure we'll talk about this a little later with the Office of Recovery, really the hope is that we will be able to unite the field, understanding that we have differences, but also understanding that we have probably more similarities than we talk about, and really coming together to really push for, effective programs, policy, services that really help people on the ground and in communities.
Yeah, there's so much that you just spoke about there. First of all, I wanted to let you know I appreciate your honesty and ability to share some of the journey you went through in recovery. I know that many people have loved to hear stories from other people to find that kind of support. So I'm sure folks would appreciate that. And I can't wait later in the conversation to talk about some of the more innovative approaches to recovery. But first, let's take a moment to actually just talk about the Office of Recovery at SAMHSA. So for those who may not be too familiar, what, in a nutshell, is your mission, and how do you support people struggling with substance use, especially in their journey in recovery?
Really the purpose was to elevate recovery within SAMHSA. And so having the office under the Office of the Assistant Secretary was really important to our leadership, because we know recovery does happen, and it really is intertwined through all the work that we do. And so the purpose of our recovery office is really to forge partnerships in order to support people, families, communities that are impacted by both mental health and substance use conditions, to pursue recovery, be resilient, and achieve wellness. And I want to stress that this is not just about substance use, but it's also mental health. And so we're really trying to be inclusive across the board and make sure that we're not only talking about people that are in recovery, but also families and communities.
Yeah.
That is what we identified as a result of a recovery summit that we had back in August. It was the first time that SAMHSA had hosted a recovery summit, I think since 2012, I want to say. And back then, when SAMHSA hosted the summits, they were really focused just on substance use. And we wanted to make sure that we were really inclusive to have folks from all across the field at this recovery summit. And there were 5 things that we identified from stakeholders, because what we did was we really listened. The first one was inclusion, really making sure that people with lived experience are part of any practice or policy, and ensuring that, our voices are heard. We also heard a lot about equity to make sure that underserved and under-resourced populations are reached. And that's not only including people of color, but also young people, youth, older adults, LGBTQ plus, the rural communities, veterans, and people with disabilities. And then looking at peer support services. So how can we expand peer provided services within every community across the country? And then we heard from that recovery summit that social determinants play a huge part. How do we help to address these social determinants that include recovery housing, education, maybe social supports, employment? And then the fifth thing was wellness. So we want to make sure that as an office, we really help to expand holistic self-care strategies to improve health and behavioral health outcomes. Looking at the reduction of early mortality and the impact of comorbid chronic health conditions, and integrating recovery-oriented practices. And, not only at the community level, but also kind of probably idealistic a little bit, but systematic changes, looking at the full continuum of health and behavioral health care, which would include, prevention, harm reduction, treatment, crisis care, recovery supports. So those are, the things that we identified and will be the things that we're working on.
Yeah, definitely. Thank you for breaking down those 5 takeaways. I think they're really key, and I think they dovetail well with the 4 dimensions you were talking about before: health, home, purpose, and community. So I just want to ask you, why those 4 elements? How do they influence the work needed to support people in recovery? And, those last 3, home, purpose, and community, it gets to the equity lens that looks very different for different people. So what do these elements of recovery mean, and what do they mean to you as a recovery expert?
SAMHSA's recovery definition and the dimensions have kind of withstood the stand of time, like when they were identified back in 2005. But, when you think about health, it's really about choosing your own individual pathway. How do you take care of your health, physical health? Because certainly during an active addiction, I wasn't taking care of anything. And so, it's really important to kind of focus on that, as well as, when we look at some of those other comorbid conditions that come with addiction, hepatitis C, maybe HIV, AIDS, those things, also taking care of yourself in treatment and keeping up with your health is really important. Having a safe and secure place to live is, I would say, probably most important. I was lucky enough when I got into recovery that I had family that helped me, because of course I had no money. But then I was able to get some assistance through subsidized housing in Pennsylvania, because I was a single mom at that time. That was really helpful for me. It was safe, the neighborhood I was living in. I wasn't going back to the same, kind of like neighborhood, because I know when I was living with family members in my early recovery, I literally would not drive past or through my town, because I knew if I ran into somebody, it probably wouldn't be good for me. And so I would go out of my way to go some other way. And the other thing, purpose, that could be anything from volunteering to finding a job, going back to school. Part of my purpose, I really feel, was getting back into the field, but it was also to further my education, to also, be a role model for others or mentor others that come after me, to really encourage them to be the best they can be, whatever that is.
Yeah.
Being able to volunteer in places like a soup kitchen or at a church or whatever that fulfills me, which also is part of lifting up our self-esteem. Because I don't know, I feel sometimes like I'm more sensitive maybe than the average person because of my substance use disorder, my addictive brain. And then being part of a larger community. For me, in early recovery, I literally surrounded myself only with people in recovery. And I think everyone wants to be part of a community, right? Whether that be their church congregation or that be, a 12-step program or that be a fitness group, we all want to be part of a larger community. And I think that really helps to support and sustain. And, I also believe, it gives you, like, when you're having those really, really rough days in recovery, because we do have them, which we don't talk about enough. We act like, it's always peaches and cream, and it sure isn't. But, it really does help us, kind of get through that, seeing light at the end of the tunnel so that we can just get through another day.
Yeah. While the Office of Recovery at SAMHSA does support these dimensions to recovery, I kind of want to take a moment too to talk about the services and resources that your office provides and any partners that you work with. I know that there are many at the state and local level. So if, say, a listener is in recovery right now or searching for recovery, can you highlight some of the important ones and what kinds of programming and resources they or their loved ones who want to help them can use?
Yeah. So, SAMHSA has quite a few resources that are available to those that are, seeking recovery. And, we have our resource webpage. If you go there, you can certainly find lots of good resources around, treatment, recovery, all kinds of stuff that are evidence-based. And then we also have our treatment locator. If you go to our website, you can find, you can click on a button, you can find whatever you need within your own community, because it's really important, I think, for folks that are seeking some help to know that there is help that's available within their own communities. So they might want to go to their state agency. They might want to go to their local county authority and reach out to find out what is available within their community. SAMHSA also funds several recovery-related grants. We have the Building Communities of Recovery, and those can be found on our website as well. We also have our statewide Recovery Community Program grant. The way that funding is allocated by Congress, it comes to SAMHSA, and then SAMHSA allocates it to the states. Mm-hmm. And each state is a little bit different, right, in the way that they provide funding to their communities. And so while it's great to be able to get a national or a federal resource, I think it's really more important to get the resources going to help you right at home.
Yeah, and that makes sense because, again, region to region looks different, town to town, with
neighborhood to neighborhood.
Exactly. Yeah. So, your grants and funding do help support a lot of different programming that people can tap. I know that some of the more forward-thinking ones lately have been like harm reduction, but there's also coaching, recovery housing, and other services. So what role do you see some of these sort of emerging forms of recovery tactics playing in this space, and how do you see them sort of evolving in the future?
As we started to develop the Office of Recovery, probably the most important thing for leadership was that people with lived experience or family members would be employed in this office. And so we all freely talk about our own personal recovery. And, we have that connection so that as we look at and work with, we kind of liaison with the different centers within SAMHSA, different centers, different offices, the regional administrators, to really, connect the dots. Really, right now, we're really focused on is kind of reviewing a lot, reviewing our website, mm-hmm. looking at National Recovery Month again. What role does SAMHSA play or not play, in helping to elevate that? Because now, over the last couple of years, Faces and Voices of Recovery has kind of taken the lead on that. But, how can we support the field to really ensure that, we're just not talking lip service?
Yeah.
Everything that we do, we include stakeholders, invite them to the table, ask questions of them, because at the end of the day, it's the communities that are doing all the work.
Yeah.
Boots on the ground.
I'm kind of curious. Sometimes as family or friends of people with substance use problems or people who are struggling with, mental health, sometimes we have to have that tough initial conversation to help a loved one enter recovery sometimes. Can you sort of walk people who may be in that position through how they can approach that tough conversation?
Yeah, I wish there was a magic bullet for that, but there's not. It is very difficult for sure. I remember way back when it was always about tough love, but I think we've come to a place where we realize that people have a disorder that affects their brain and they're not thinking clearly. And so for me, whenever I speak with somebody, I try to approach it with love and compassion because one, I know, for me, that tough love kind of thing would push me away. And so, I try to think of my own experience and also, approach people with empathy, compassion, love, and the resources that they need in order to move forward if that's what they choose to do.
Yeah, I completely agree with you there. Yeah, I went through my own bout of like a mental health situation back when I was in college, and, I had my family step in and help me out. So I definitely understand what you mean there. And thank you for sharing that. You were mentioning the importance of family, but we can also find different networks and structure to help us with our recovery. So places like the workplace and employers can aid in recovery too. I know you mentioned that you had an employer who tried to help you out. I know that some folks here at Fors Marsh recently did a workplace recovery survey that will come out soon. And the survey did find that over 70% of employees said that if a worker disclosed that they were in recovery, their opinion of that coworker would remain the same or even improve. So can you share your thoughts on what kind of impact workplace recovery programs can have in helping people on their recovery journeys too?
Yes, absolutely. So, there are lots of states and lots of organizations that are investing in recovery-ready workplaces. I do believe that as we talk about the dimensions, we talk about health, home, purpose, and community, right? And if a person has a job and they have support from their employer and their coworkers, means a whole lot more on that journey of recovery, really helps to support them. And I think, as we talk about a little bit before about being able to find the support and the way and the fact that addiction and recovery has kind of come out of the shadows and been elevated in a way because of campaigns that have really highlighted all of this, employers see that there really is, I believe, a cost benefit to people that to supporting people that are in recovery. The Department of Labor, ONDCP, SAMHSA, we are investing in a lot of, as part of the president's agenda, right? Yeah. So we're investing in a lot of money into this because it works. Mm-hmm. There is the data to back up the fact that, in the long run, it really does work.
Yeah. And speaking of other forward-looking initiatives and efforts that we can use to help elevate the importance of recovery, SAMHSA earlier this fall held and announced winners of its first ever Recovery Innovation Challenge. So I just want to take a moment to ask you, how you think it went. Were there sort of any standout solutions that you want to share? And generally, how can challenges like this or other partners in industry or the private sector sort of help move the ball forward with the recovery field?
Yeah. The Recovery Innovation Challenge was really to look at kind of how SAMHSA's recovery definition was operationalized in organizations across the country. I think most community-based local organizations on a day-to-day basis, are doing that work without really realizing the impact that they're having and actually how they operationalize that. We put together this challenge and, it went out to the field and I know we got several hundred applications received, both mental health and substance use, some that were co-occurring, and looking at like how are organizations really helping to push forward recovery? One of them was a hotline out in the West, which was just focused on kids and young people. So it was like a peer warm line where kids could, call and just talk to another teenager in order to help to support them. And so, we don't necessarily know that's happening at the national or federal level just because, there's so many things that are happening. It's hard to know everything that's going on. So periodically, I believe we're going to be bringing those folks together, just to talk with them through the Office of Recovery, kind of as a stakeholder group, just to see what's going on. but I know there were some that did really good, had really good applications, or doing really innovative work. Some with certain specific populations, and others that are just working within the community. So it was nice to see, I think, to really reinforce too our recovery definition in the work that's happening across the country.
Yeah, I'm sure, the benefit of including so many different people is that I think it shows that it's not always a one size fits all. So
yeah, exactly.
Yeah, that's really exciting. And as we sort of come to a close here, this episode is coming out at the beginning of January. So it's a good time for us to reflect on the new year and think about the future. What's on your mind right now as we're entering 2023? And what also keeps you motivated, especially since, while you are clearly very driven in this field of recovery, some of the news around substance use, overdoses, and mental health can be pretty bleak.
Yeah, I will tell you, I have those days where I'm like, geez, a lot has really changed. It really has. Do we have a long way to go? Absolutely. But I think one of the things for me is being solution oriented, really looking at innovation, different ways, because, what works today isn't going to work 5 years from now, especially around young people.
Yeah.
Thinking about technology and how that in social media and how that impacts them, and how that, it was eye-opening when we did this roundtable with young people, the way that they talked about their own recovery. Like, when the guy said, I found it on YouTube, I was like, what? It's really different today. I walked into a church basement. That's how I found recovery. And I think COVID taught us a lot around not how can we be ahead of the game. And so, as we see new, synthetic drugs or whatever that are coming out, how can we be ahead of that? How can we look at different ways to help treat people or provide recovery support services in ways that maybe 15 years ago we would have never thought possible? One group in Pennsylvania that's doing kind of like a virtual kind of recovery thing, which, like, who knew? But when I think about, actually going into a virtual group is pretty amazing. And so, being able to, just think about those things and being open to it, listening to the field, learning from the field, I think it, is really super important. And then really helping to mentor those that come after me to kind of get as excited as I can be some days to really kind of push the needle and push the envelope and say things that may not be popular to others, but it's okay because it keeps the wheels turning, right?
Of course. I wanted to thank you, Dona. I'm feeling really refreshed and, wonderful coming out of this conversation. It makes me feel really great about going into 2023. And I hope our listeners feel the same and walk away with some new tools to help themselves and their loved ones, not just as they're thinking about New Year's resolutions, but holistically going forward.
Thank you so much, Melissa.
I don't know about you, but after that, I felt charged and lucky to have people like Dona doing the real work to help people in this country. If you are someone who is in recovery, considering recovery, or are supporting someone in recovery, I really hope you don't feel alone. Folks like Dona and her colleagues at SAMHSA are here for you. Also, I want to take a moment to highlight the resources that Dona touched on. Go to samhsa.gov, that's SAMHSA.gov, for information about recovery, treatment, prevention, grants, training materials, and more. And please, please call 988, the Suicide and Crisis Lifeline, if you find yourself in crisis. I hope y'all are having a very happy new year. Take care, and please join us again in February for our next episode of Empathy Effect, where we'll chat about diversity, equity, and inclusion in federal research grants.
Empathy Effect is a product of Fors Marsh. You can reach us at Fors Marsh Media at forsmarsh.com with any feedback, questions, or inquiries.